My name's Heather Moran. I'm the psychologist in the neurodevelopmental service, and we thought it'd be helpful to tell you about why we offer some of the things we do with parents and why we do more work with parents than we do with children and young people. So first of all, it'd be useful to think about what is the effect of having autism or ADHD on daily life and how that might have an impact. So the first difficulty is reading social situations. So most of us can go into a situation and work out what people need us to do, what people are up to in that situation. So we might go to a party and know that people are chatting, and we know that we're expected to join in the chatting. So coping with that kind of thing is something that people with autism find quite hard, and knowing what to do when is something that people with ADHD might find difficult. They might get talking but interrupt too much, or not look at the person that they're talking to, or walk away before somebody's finished chatting because they'd lost interest and they forgot that they needed to end the conversation well. The other thing to say is there's an idea called mind reading, and mind reading is about being able to work out what people want you to be doing and what they might be thinking about what you're doing and how that affects them and what they're thinking about is going to happen next. That's very difficult if you're not paying attention to the situation, and also if you have difficulty reading people and knowing what their emotions are, guessing how to get on with that particular person rather than thinking about people in general, and being able to work out what somebody might need you to do next rather than what you're doing now, and if you do it, what's likely to happen. So the mind reading feeds into deciding how to interact with somebody and then deciding what to do. And those kind of things are quite difficult particularly for children with autism. Another bit that's key for autism more than for ADHD is the difficulty being flexible. So knowing that plans might have to change, you might have your tea at a different time, you might need to go to bed at a different time because you're on holiday. You might need to use different crockery or wear different clothes for different occasions. Those kind of day-to-day flexibility issues are often quite hard for people with autism, particularly for young children. So they will tend to do things in a pattern that they like, but that might not fit in with the rest of the family's pattern. There's also some difficulty for both groups with coping with competing demands. If you've got to do something like tidy your bedroom, what you need to be able to do is think why you need to tidy your bedroom, then go and start doing it. And that takes some planning. So being able to think, okay, to get it done quickly, I need to do this, and then not be distracted by what's going on around you. So often parents will tell us that they gave the child a straightforward instruction, like go upstairs and fetch something. The child didn't come back, and when they go to look, the child is sitting on their bed reading a book, and they've forgotten what it was they went for, because they saw the book there and were distracted by it. Now, day to day, that causes quite a lot of difficulty, because a lot of what we do is in a routine that suits the adults, not necessarily the children, and the children have to follow along. So something like getting ready in the morning for school means that you also have to be able to, as an adult, plan what your children are doing, know where they're up to in the sequence, and think how you're going to get it all finished and get yourself out of the door, drop them at school and get to work. For each one of those children, they may not be able to think about what it is that you're up to. And they're just thinking, well, I'm watching TV, this is fine, and then I'm going to school. They're not thinking about the whole sequence. So their bits of it might be taking too long or not be done in the right kind of way, or things get forgotten. And that sort of planning angle relies quite heavily on the parents of children both with ASD and with ADHD. There are quite a lot of difficulties for children with autism with coping with emotions. So being able to know what feelings they've got, being able to name them, and then to tell other people what they are is quite hard for them. So they might know very basic emotions quite easily, so they probably know happy and sad and angry. But other emotions, like being subtle with things, like, you know, when you're teasing somebody, you need to be able to tell if they're feeling okay about the teasing, if the teasing is going too far, if they're responding all right and you need to carry on, or if it's getting wrong and you need to stop. So something like that means that you've got to read somebody's face, you've got to look at them and think how they're responding and feeling inside. And you've got to know that something you can do can change that feeling. So sometimes young people, particularly with autism, find that really hard. Often children with ADHD get that a bit wrong too, because they're not paying enough attention and they're so caught up in the moment, they're not thinking how the other person is reacting, they're not watching their face closely enough. And we know that both groups will get the sort of timing wrong for a lot of those things. There are also some issues with coping with sensations, and those are things like being able to be in a room with lots of people, cope with the noise, cope with the sounds, cope with the smell of them, cope with them being near you. And both groups have some difficulty with that kind of thing. One of the difficulties both groups of children have is understanding time. So that gut sense of time, so that you realise that something is taking a long time. It's been 5 minutes now, and you can have a sense of what 5 minutes might feel like, is something that doesn't seem to work very well for quite a lot of the children with either autism or with ADHD. So they can be running late for things, so particularly getting ready for school in the morning or leaving school in the afternoon or getting ready to go to a club or going out shopping on a Saturday. They will tend to rely on the clock. So either they don't notice the time at all and the adults are having to tell them, or they use the clock to do what they can't do just intuitively. So they'll be looking at the clock and saying, okay, we're 3 minutes late. And 2 minutes before it's time to go, they will have already been saying, but we're going at 11 o'clock and nobody's ready. How are we going to do that? And one of the things that parents tell us a lot is that children will repeatedly ask questions about time. How long something is going to be, when it will happen, how long they'll be there doing it, what will happen next. So getting that sequence understood. For most people, we don't need that level of detail. We can go with the flow. We can think, okay, that'll probably take us about 10 minutes. And if it goes over 10 minutes, it won't bother us. But for children with these kind of difficulties, it is quite a problem. Okay, so overall, these kind of difficulties affect interactions with other people. They affect how you can respond in certain situations. They make a difference to making friends, keeping relationships going, keeping friends, and being able to mix across a variety of situations, and being able reliably to show the right kind of behaviour according to the situation. That's quite a big list of difficulties. And in the NHS, we've got to make sure that we use money wisely and we don't do things that we know aren't really going to work. So there's plenty of evidence to say that some things don't work, and then there's good evidence to say that some things will work reasonably well. But what won't probably happen is something gets rid of the core symptoms of ASD or ADHD. And over time and more research studies, we've been able to find that out. So over the 30 years that I've worked with children with ASD and ADHD, lots of things have come along, been tried and found not to work. And what we know works is slow, persistent behavioural guidance, and also helping children to understand emotions and helping them to learn skills over time. But we know that maturity makes a huge difference. So for a 6-year-old, there'll be things that, ways of talking to them that we wouldn't do, that we might use with a teenager. Often parents and carers or teachers really, really want the child's behaviour to change because they can see the trouble it's causing and they understand if things carry on like this, what's likely to happen. They can see that it's going to make it harder to make friends, that it's going to be harder to get on with your teacher, that going to secondary school will be more of a challenge. So they're often really motivated to help their children to develop new skills. However, that doesn't mean the children understand that. So for particularly young children, they don't understand what it is they need to do. And doing direct work with them is not very effective. So where people have tried lots of different therapies with young children, almost to get rid of the symptoms of autism, it hasn't really worked. What we know works is helping parents, because parents can be there all the time. So what the children need more than therapists is sort of coaches. They need somebody who can encourage them, somebody who can see that this is something that they've tried before and they know how it went and they can try again. They need somebody who can cheer them along when things are going well and can point out their successes, because they might not be very good at realising, okay, I've just coped with something I didn't used to be able to cope with. If we can help parents to be really good coaches of their children, then they can be there to do that task. Now, there are services in schools that do the same kind of thing to help teachers who are in the classroom work with children with autism, work with children with ADHD, and that tends to work better than if we pull them out into a clinic. It's not very successful to take children away from the environment the behaviour occurs in and try and get them to understand how to do it differently when they go back to that place. That's called transferring the learning, and it doesn't happen very easily. So it's not a good idea to have children come to a therapy group for 6 weeks about making conversations out of their usual situation. That's more likely to be effective if it happens in school and if it happens with children the children already know, and if the teacher knows what they are, so they can prompt the child and they can say, okay, remember when you were learning to take turns in the group? This is the same kind of situation, so they can make reference back to it. The problem with pulling children out for therapy sessions is it's much less likely to work because of those issues to do with generalisation of learning. So if we want to learn how to behave differently, we first of all need to evaluate the situation. So we need to be able to think, what happened last time when I did this? What was happening just before I did it and wanted to do it? What happened afterwards, and how did that all work out? So being able to evaluate is something that happens as we get older. We get much better at it. Young children are quite poor at evaluating situations in comparison to teenagers. So as we get older and older, we learn to do that better and better, so that we make fewer mistakes with people, we don't upset so many people, and that applies to everybody, people with and without autism. People with ADHD are the same, people with autism are the same as the rest of us in that respect. We all improve as we get older, and we learn to cope with things as our brain matures, and we develop systems for understanding situations, and it's much easier to learn once we get older. So if we take all of that into account, then we're much more effective as a service if we can help parents and carers to do things differently with their child and to understand why they need to do it differently and what it is about the child's difficulties which will make it easier or more difficult to learn certain things. So we've put a lot of investment into helping parents to understand, because they're more likely to be there with the child than we ever would be. So we offer a number of different things for parents. All of our parent interventions are based on our understanding from a number of different professions. So we have within our team speech and language therapists, occupational therapists, psychologists, and all of us can give an input to that kind of approach, so that if there's a session about communication, we'll be bearing in mind the information that might have come from OT about standing too close to people and how that might feel for some young people. We'll also be thinking from a psychological point of view about what people are trying to achieve. It's not only about helping children to communicate well. So we're able to use that information from our different areas of research and pull them together to make sure that what we offer to the parent sessions is the best that it can be, whatever session it is. The main problems that parents come to us with fall into difficulties with the communication, which is how the children have been diagnosed with autism in particular, but difficulties with behaviour, and they tend to be around coping with things that make them feel anxious and worried, and coping with things that make them feel annoyed and upset. So those kind of things are called emotional regulation, and our parent session on emotional regulation aims to help people to understand what that is and what it's about and ways that they can help. We also have sessions on improving communication skills and talking with your child in a way that they can understand more easily. And we have sessions for parents about understanding anger in children with these difficulties and what sort of things we know will work better and what sort of things not to do as well. Another reason that we often run groups of parents is that parents tell us they find it really helpful to learn from other parents. So within a group situation, and the groups tend to be small, they'll be able to hear what other parents say. They'll listen to questions other parents ask, and they might be able to help answer those questions. So parents often will say, actually, that was one of the best things about coming. It wasn't just the information that we gave them, it was meeting other people who had a shared interest and goal and also face similar difficulties. We know that there are some parents who come who really don't like interacting with people and would much rather sit quietly on their own. So we take that into account in the way we run sessions, and there's never pressure to interact. There are opportunities if people want to do that, but also if they want to just come and sit near the door, have a nice escape route, then that's fine too. We're trying very hard to offer the right things to families so that parents can understand what to do with their children and use it well. But we're open to suggestions. So if there are things you think would be really useful to have some sessions on, then get in touch with us and let us know, and we'll see if we can do something about that.